like to talk about vestibular rehabilitation. First, we'll talk about the difference between dizziness and vertigo. So most people experience dizziness in various situations, and most commonly you feel like you're standing on a boat and the surface is rocking, okay? So then you could feel out of balance and that you want to fall down. Sometimes you feel nauseated as well. Vertigo, on the other hand, is very specific. You'll feel like the room or the environment is actually spinning around you, okay, rather than you are moving like dizziness. There are many things that could cause dizziness, such as blood pressure, medication, and various other reasons. But today we'll talk about vertigo in specific. The most complaint of vertigo happens when people are turning in bed and they would actually wake up from their sleep because of this vertigo, which is the room spinning around you symptoms that we talk about. It usually happens when you turn to one side. The other possible situation is that when people look up and turn, that might trigger the vertigo. So the hallmark of BPV, which stands for Benign Positional Vertigo, which means we don't know what causes it, but it's brought on by position change. So when people feel the BPV, usually you will feel the strong, severe symptom of the room spinning around you. You'll probably feel very nauseated. Some people might actually vomit because of that. It is not a very pleasant symptom. However, this symptom should subside within 1 minute. To explain what happens in BPV, we need to talk about anatomy a little bit. In our ears, there is this vestibular organ, which composes of a number of components. To simplify it, we have 3 semi-circular canals. They are basically like tubes. Inside there is liquid. So we have 3 of those tubes, and that's connected to a box, okay? So the semi-circular canal, it's used to measure angular momentum. Basically, if I turn my head quickly, the water inside the tube will move quickly. That's how our body senses motion. However, when we come to a stop, the liquid will stop. So these 3 semi-circular canal is connected to a box we call Utricle. And inside the Utricle, there are crystals. We call them Otolith. Basically, when we move, then gravity will move these crystals, and that's how our body senses gravity. So in the case of BPV, we believe that for some reason this crystal has escaped from the Utricle, which is a box, into these tubes. So now when you turn your head, we talk about once you turn, the liquid stops with the inertia stops. However, because the crystal is in the tube, so you might still move, and this causes our body to have this mix of information between the motion and the gravity, and therefore you actually create this sense of vertigo. And because it's mechanical, affected by gravity and motion, once the crystal stops moving, you will not have the vertigo anymore. And that's why we talked about the symptoms of vertigo should subside within a minute. So what do we do with vestibular rehab? So in the clinic, we actually could do a number of clinical tests to identify which canal has the problem. Basically, if we move your head in various different maneuvers, we call them, we could detect if you have a specific movement in your eyes. We call it nystagmus. So for example, the most common cause of BPV is the AP canal. And most people know it as the Dix-Hopike maneuver. And in a very dim light or in complete darkness, your eye, let's say my right side is affected, would actually, let me show you this, you actually would torsion, okay? So you actually spin, the pupil will spin. That's how we know it's the AP canal. In the case of horizontal canal, when we do the test, you actually see your eye go sideways. So clinically, we could use different tests to confirm which canal that has the BPV. And therefore, when we treat it, we do a very specific mechanical maneuver to get the crystals back. So for treatment, a lot of the time people will hear about the Epley maneuver, which usually is used to treat the AP canal, which is the most common cause of BPV. You could probably find a lot of these on YouTube and other videos. However, if you have other causes of BPV, such as in other canal, we need other maneuver. Sometimes I've seen very complicated situation where we talk about these crystals actually stuck in the wall of the semicircular canal. So the maneuvers will not help to solve that. The other common cause of vertigo is actually due to vestibular loss. Usually only one side of your vestibular system is damaged, so we call it UVL, which is unilateral, meaning one side, unilateral vestibular loss. So that's called UVL. Very rarely would you see both sides damaged, okay? So with the UVL, if the sensor is broken, we can no longer fix it. Therefore, we need to do some exercises to train our brain to compensate. So there are some exercises such as we call eye tracking exercises, and there are these habituation exercises that we could use to train our body to use whatever we have left to maintain certain amount of balance. These exercises can also be used after concussion, because a lot of the time post-concussion, some people will have dizziness, and therefore we could use these exercises to help your brain as well. So the vestibular system is actually a complicated system that has a mixture of our organs, our sensors, our tubes and cupula that we talk about, but also centrally speaking, our brain need to process this information to keep our balance. So the best way is that if you have these dizziness or vertigo, I would suggest that you see a professional to properly diagnose them and treat them.